Well, I'm going to welcome people and thank you for joining us and coming out this very frosty morning. We actually required scraping of the windshields. But we're very, very fortunate to have Pat Paradis from the SHINE program at Elder Services of Merrimack Valley with us this morning to talk about changes that are coming in terms of health insurance and SHINE, which stands for Serving the Health Insurance Needs of Elders, provides us with ongoing support during the year. But at this time of year, with the open enrollment happening, it's an integral part of what we need to know. And we also have our wonderful SHINE counselor, Jerry Goldberg, who provides us with office hours during the month, but as well as with ongoing support. So and I'm going to keep information in the office that Pat's presenting, and as well as the contact information for Pat and for Jerry. So if people need anything further after we're through here today, please give us a call at our office, and we'll make sure that we get the information to you or schedule appointments with the wonderful Jerry. So I'm going to turn right to you.
Well, thank you. And there is a lot of information, and it's a very complex decision that you're going to have to make. So let's talk first about SHINE. It stands for Serving the Health Information Needs of Elders. We have free, unbiased counseling service to Medicare beneficiaries. We're not associated with any insurance company. We're just here to give you all the options that are available to you and to help you with any questions that you might have. We have 600 volunteer SHINE counselors throughout the state of Massachusetts. We're located in almost all the senior centers or the Council on Aging. And again, it is a volunteer program, and they are very dedicated volunteers. And you are very lucky to have Jerry. He does a wonderful job. Thank you, Jerry. Last year, those 600 volunteer SHINE counselors saved the state of Massachusetts $70 million in health insurance costs for seniors. So you can see that it is a very valuable program, and we are fortunate to have it. Well, we are here to talk about open enrollment. And I'm sure you've seen it all on the TV, and I'm sure that you have been receiving tons of mail from everyone who's trying to buy for your business. Open enrollment with Medicare is October 15th through December 7th. That any change you make will take effect on January 1st. Now, it is very important that you know it ends December 7th. Because for most everyone, if you don't do anything, come December 8th, there is not too much we're going to be able to do to help you. It has to be completed by December 7th. This is when you can change your Medicare Advantage plan. Does everyone know Medicare Advantage? That's your HMO, your PPO, that kind of thing. Or your Part D drug plan. This is the only time during the year that you can make any changes to that, unless you have a certain special election period. But for most people, this is it. So, let's start maybe with, does everyone know the difference between a Medicare Advantage plan and a Medigap plan? Because there are only two types of these plans that you can get to supplement your Medicare. One is a Medicare Advantage, and that is your HMOs, your PPOs, where you have to have Medicare, but you can't use your Medicare. The Medicare Advantage plan is your primary insurer. The Medicare Advantage plans have the Part D drug plans built right into them, so that you don't need a separate drug plan. But it's an HMO or a PPO, which means you can only see a doctor who is going to take that plan. He can only refer you to a doctor who is going to take that plan. You can only go to a hospital that's going to take that plan. And they have copays and deductibles. On the other hand, there is a Medigap plan. Medigap plan is a supplement where Medicare is your primary insurer and the Medigap plan is your secondary insurer. Any doctor in this country will take Medicare and a Medigap. So and it's strictly medical coverage, no drug coverage. So at that point, you need to have a Medicare Part D drug plan. You have two papers, a yellow paper and a blue paper. Oh, thank you. The yellow paper lists all the Medicare Advantage plans that are available in Essex County. Because unlike a Medigap plan, with a Medicare Advantage plan, it depends on where you live, what you can buy, and what the cost is going to be. So since you all live in Georgetown, you live in Essex County, and this is what is available for Medicare Advantage plans in Essex County. The blue paper are your Medigap plans. There are only 6 companies. Well, I'm sorry. This year there are 7 companies starting January 1st that are going to be selling Medigap policies. They can only sell 2 types of plans, and you can see there are 2 columns, a Medicare Supplement Core and a Medicare Supplement 1. What people need to understand, and this is very difficult, amongst these 7 companies, the only difference in coverage is the price. So if you look at the first Blue Cross Blue Shield, that Supplement 1, MedX Bronze, that is $183 a month. It's going down, by the way, for January. It's $183 a month. Is the identical same coverage as the one on the bottom that says United Healthcare. That's $211 a month. Or the Tufts plan, that's $181 a month. Identical same coverage. It's just the price. But there are very big differences between the core plan and the supplement 1. And if you turn your page over, this shows you the differences. The core plan does not pay the Medicare A deductible, but the supplement 1 does. The core plan does not pay the Part B Medicare medical deductible. The supplement 1 does. And the other very big difference is the skilled nursing facility. And everyone needs to know that that is rehab. That is not a nursing home. No one pays for a nursing home but Mass Health and you. A skilled nursing facility is rehab. Medicare will pay for the first 20 days you're in rehab. You pay nothing. But starting on day 21 to day 100, and 100 is the maximum days that Medicare is going to pay for anyone's stay in a rehab. Day 21 to 100, the copay is $144 a day that you are responsible for. The core plan does not pay that. The supplement 1 does. So you can see there's a big difference in the types of coverage. Does anyone have any, do you all understand the big difference between the two? An HMO has a network. You can only go to that network. With a PPO, you can go outside the network as long as they will take it. But your co-pays and deductibles are higher. With these Medicare Advantage plans, you're going to have to pay a copay every time you go see the doctor. There's most of them have $150 copay if you use an ambulance. A lot of them have a copay for the first 5 days you're in the hospital. Say $400 a day for the first 5 days you're in the hospital. All the plans, these Medicare Advantage plans, have different copays and deductibles. So if it's something that you're interested in, and you can see this middle one, United Healthcare, AARP Complete, that premium is only $20. Against your MedX Bronze, that's $183 a month. This includes the drug plan. This you have to have a separate drug plan. But here's the thing. This AARP is the one that has $400 a day copay for the first 5 days you're in the hospital. So if you go in the hospital and you're there 5 days, you owe $2,000. It's going to be every time you go see the doctor, you're going to have to pay a copay. And your doctor has to take it. But if you have the PPO part of it, you can go out of the network. But your copays are going to be higher. Maybe the copay is $30 to see a regular doctor. It might be $50 if you're out of the network. So those are how they work. Okay, we all set on that? Now we'll get into... Oh, the other thing that I want to mention, with the Medigap, again, it is strictly medical. But this year, I don't want to pay, unless they want to write on them. If they write Humana on them, they can have them.
Okay.
I don't want them to get them confused.
Yep.
Up until January 1st, all of these plans just covered your medical. Doctors, testing, lab work, that kind of thing. If you look in the middle of the page, Humana offers the core plan and the supplement one, but they have started something new for January 1st. And they are going to offer a rider to the core plan and the supplement one. And what that's going to do is give you some dental coverage and some eyeglass coverage. Now that's the price. It's about $12 a month for added on to the premium. So instead of the $214 for the supplement one, if you take the rider, it's going to be $226. But with the dental coverage in the network, you're going to be able to get cleaning twice a year, oral exams twice a year, x-rays once a year, extractions. And if it's something you're interested in, the phone number is here. Call Humana. They will send you a packet. Under the vision coverage, you're going to be able to have a routine eye exam once a year. And they will give you an allowance of $100 towards glasses. So we're hoping this is going to be the trend, but the Humana is the only one who is offering that. So you should know that that's available. Okay, now we're going to get into the fun part. Medicare D. Everyone knows Medicare D, the Medicare drug plan. Mm-hmm. Everyone have a Medicare D?
You do. Mm-hmm.
Does everyone have a Medicare drug plan?
Yes.
Okay. Everyone understand how the drug plan works? That they all have a premium? Some have a deductible, some do not have a deductible. But they all have one very big thing in common, the donut hole. And if you take the paper that looks like this, 2013 Medicare Part D standards, we're hoping that this simplifies it for you. This is how the donut hole is broken up. Once the retail cost of your medication reaches $2,970, and that's the retail cost, what you pay and what your plan pays. Once the retail cost is $2,970, you fall into the donut hole. And you are in that donut hole until you have spent $4,700 out of your pocket. And then once you reach that $6,700 level, you go into catastrophic coverage, where you then only have to pay 5% of the cost of the drug. But that's the donut hole. If you turn it over, it talks about how you fit in, but remember that it is the retail cost of the medicine. We are very fortunate in Massachusetts, one of the few states that have what we call a state pharmacy assistance program. Every senior in this state should be on prescription advantage. What this does is cover you in the donut hole. If you're on prescription advantage, you don't have a donut hole. People will say to me, because it is an income-based program, they look at your income, not your assets. They don't care if you have $1 million in your 401k. All they care about is, do you take $500 a month? Do you take $10,000 a year? Then it becomes income. But they only look at your asset, your income. So people will say to me, well, I make too much money to be on prescription advantage. So my first question to them is, are you married? Yes. Well, combined, do you make more than $75,000 a year? Well, no. Well, then you're eligible. Up until if you are single and you make less than $33,000 a year in your income, this is free. You pay nothing. You fill out an application, you submit your verification, and it's free. Even if you don't reach the donut hole. You say, I only take one drug, so it really isn't going to benefit me. You never know what is going to happen. So everyone should be on this program. I often tell a story about a lady who ended up in this last category. In category 5, you do have to pay an annual $200 enrollment fee. And that's if you have income between $55,000 and the $75,000. That you would have to pay a $200 enrollment fee. And this lady was in that last income category. Didn't even have a Part D drug plan because she never took any medication. She came in to see us because she has cancer. One medication that she was taking, $1,500 a month, just for the prescription. We signed her up for prescription advantage, which gave her a special enrollment period to get into a drug plan. She paid for her medication for 2 months, and for the next 10 months it was free. So you never know what's going to happen. If it's free, you need to enroll. And Jerry has the applications, and he would certainly help anyone. Okay, Medicare drug plans. That's the one with all the little lines on them. These are the Medicare drug plans.
Can I ask a question?
You may.
Okay. If I signed up for a Medicare Advantage plan, do I still need to have a Part D?
Absolutely not.
Okay.
You must get your drug plan through the Medicare Advantage plan. And you have to. You cannot say, oh, I'm going to take this cheap plan. And you can see some of these plans don't have a drug plan included. The only way you could use one of these Medicare Advantage plans that doesn't have a drug plan is if, say you're with the VA has creditable coverage. So you don't have to get a Part D drug plan. But if you don't have creditable coverage through the VA, you have to get your drug plan through here.
So creditable coverage through a work plan?
If you had a work plan, you would need this. But there are some plans that do not have drug coverage. But you have to have creditable drug coverage. Because what will happen is, if you have this, and then you try to enroll in this, it's going to knock you completely out of this. You're going to have not only no drug coverage, no medical coverage. Everyone understand that? Must get your drugs through your Medicare Advantage plan. So I know this looks like a very complicated chart, but there are some things that I want you to know. If you look in the middle of the column where it says, so it tells you the premium, it tells you what the change was. After LIS, it says, does everyone see that? LIS is low income subsidy. And that again is income and asset based. But it is very important for people who have low income subsidy or mass health that you are in a plan that has a 0 in that column. The low income subsidy and mass health will only pay a certain amount of money for a drug plan. It's called a benchmark. Massachusetts benchmark for January is $31.70. Every state is different. So what that means is you can pick a plan as long as it's under $31.70 if you have low income subsidy or mass health, and mass health is going to pay the premium. But this year we had 10 plans that fell into that category. Next year we only have 6. People have been getting letters. A blue letter. Anyone get a blue letter? Or a tan letter? And it's telling you the plan you're in is over the benchmark. So if we auto-enrolled you, we're just going to put you in another plan. You can stay in the plan you want, but your plan is going to cost you $7.80 a month, when it should cost nothing. So I can't stress enough, you need to open your mail. You need to look at everything they're going to send you, especially if it's from the plan that you have right now. Many of these plans have changed. So these are the plans. Some have a deductible, some don't. Tells you the co-pays. And even though you look at this and there's a lot of choices, you're lucky because you have Jerry. And you don't have to worry about that. What you can do,
Thank you.
he has to worry
Paying
about it.
everybody's prescription drug plan?
Yeah.
We have you have a yellow form in your hand. This is something that we devised several years ago because we were all running out of appointments. Everyone needs to look at their drug plan during open enrollment. Again, October 15th through December 7th. Everyone. I don't care if you love the plan you're in. Many plans have changed their formularies. And you know, a formulary is the drug that your plan will pay for. With that list of drug plans that you have, not every plan pays for every drug. Not every drugstore takes every plan. So you're going to fill out this paper. You're going to give us your pertinent information. Again, confidential. This goes nowhere. Jerry's going to see it. And we do not keep any personal information. Fill it out. Turn it over. Get all your prescriptions and put them on the kitchen table. And write them on here. It's imperative that it's the correct spelling and the correct dosage. And you send this to us, and we're going to run your drugs in the Medicare website. And we are going to send back to you the 3 most cost-effective plans that cover all of your medicine, and the plan is at the drugstore that you use. Everyone understand that? Have you done that before? I know we come here every year to ask you to do it. Last year, we cover 26 cities and towns out of Elder Services, and we have, what do we have, about 40 counselors now, Jerry?
Yeah.
40 Shine counselors. We did 3,000 of these forms last year. everyone understand this? How we're gonna help you with the drug plan? Okay, so no one got a blue letter or a tan letter. Another important change this year with Medicare is they are now going to pay for what they call benzodiazepines and barbiturates. Prior to this year, those are your anti-anxiety drugs, your sleeping pills, those kind of things. None of the Part D plans would pay for those. If you had Prescription Advantage, they would help you pay. You would just have a small copay. If you had Mass Health would pay for those with a small copay. It's important to understand that if your drug plan does not cover it, that's why you need to put it on that list. If your drug plan does not cover it, Mass Health and Prescription Advantage is not going to help you either. So we anticipate a big problem with that. You need to make sure that you list them and that we find you a plan that's going to cover them. They are starting something different this year again, and it's called preferred pharmacy pricing. So what that means, there are going to be certain plans that if you use a certain drugstore, your copay is going to be cheaper. You can see on the yellow form, we ask you for at least 2 choices, the pharmacy you use, and maybe one more. And then we ask, would you be willing to change pharmacies if we could get you a cheaper price? So this is all something new. So we ask you to complete that, let us know. We're going to run them. We'll look at the plan. We'll see where the preferred pharmacy is, and we'll include that. And you'll be able to see. I know that last year the Aetna CVS plan, which is a national plan, you can use it anywhere. You could use that plan at Walgreens or Walmart, even though it said CVS. But if you use that plan at CVS, you didn't have to go through the deductible. You would only have to pay $3 for a generic and not your deductible of $320 with the plan. So it made a big difference. And it's going to make a big difference this year because there are many more plans that are going to have preferred pharmacy pricing. Medicare also started last year. If you look at this paper that's two-sided, it says Medicare Part B Preventative Services. Up until last year, Medicare didn't pay for any preventative services. You could not go to your doctor and get an annual physical with Medicare. But they changed that starting last year. So anyone who goes on Medicare, within the first year, you can go to the doctors and get what they call a Welcome to Medicare exam. And this tells you when you can have it, who can have it, and how much it's going to cost. So when it says no cost, that means you don't even have to pay the other 20%. Medicare is going to pay the whole cost. Then every year after that, if you've had your wellness exam, you can have an annual wellness visit at no cost. And then this paper tells what you can have when you can have it. Mammograms, colonoscopies, These are all the preventative services that Medicare is allowing. And every year they seem to be adding more. With the Medicare Advantage plans, there are several that have left. That's why it's important. Tufts made a big change, Blue Cross made a big change. If you get anything, if you're on one of those HMOs or PPOs, you need to open that envelope and see how they're changing. Because if your plan is left the area and you do nothing, you are going to be automatically, January 1st, be only on Medicare. And you can see Medicare has big deductions. Medicare only pays 80% of allowable charge. You're stuck with 20. But the biggest thing is you will have no drug coverage. Anyone whose Medicare Advantage plan left does have a little extra time. If come January 1st, you find that you haven't done anything, you do have until February 28th to make a choice. But the problem is, if you go to the drugstore January 3rd and you don't have drug coverage, you can come see us and we can get you a drug plan, but it's not going to start till February 1st. So you're going to have that whole month with no coverage. So as I said, it's a lot of information. Jerry, can you think of anything I haven't explained?
Well, the only thing I could just say is that that's what Shine is here for. Shine is here to help. Shine is here to answer any questions. You can contact Colleen, who will contact me. You can contact Merrimack Valley Elder Services. I mean, we're here. We're no-charge services. We're here to help you and walk you through this Medicare business.
Anyone who has a retiree plan, like through Lucent or Raytheon or any of those, you need to make sure that you open your enrollment packet. This is the big time that they're all doing open enrollment. So you need to make sure you open it, you look at it, you're going to see what the cost is. You can make an appointment with Jerry. He can explain it to you. Even though it's a retiree plan, we can at least help you with the language. All right, now one last thing. I don't think I passed these out. This is totally voluntary. What we are asking is, our funding is through the state. And even though it's a volunteer program, we do get funding to do administrative work, and you can see the cost of the paper, and we help our volunteers with travel reimbursement. Well, every year the funding is cut more and more and more. We had to just let someone go because we didn't get a grant. So what we're asking is, if you would, I mean, it's totally up to you. We've written what we do, and assuming that you like the way we helped you out, you would just fill this out. We're going to collect them, and then they're going to be sent to the governor and our representatives, and just letting them know from people like you that you appreciate the service and you feel it's valuable. But totally voluntary. If you want to fill it out, you give it to us, we're collecting them, and we're going to be forwarding them. All right, let me see. Did I miss anything? Everyone knows about the VA, right? Let's talk about that. Any veterans? You connected with the VA?
No, you haven't gone.
Every veteran should be connected with the VA. Every town has a local veterans agent who could help you.
Can I do that anytime?
Pardon?
Can I do that?
Anytime. Anytime. Make an appointment. They can help you. All you need to produce to them is your DD-214. The VA offers health care, it offers prescription drug coverage, and it offers a lot of compensation that veterans are not aware about. You understand that your town agent works for the town, is reimbursed by the state, and he administers what they call Chapter 115, which is state money. They can help with costs for medical reimbursements. They can help with heating assistance. Again, it's income eligible. But that's your local town agent. The VA is federal. And that's where you can get compensation, you can get health care. And it's a whole different VA than it was even 20 years ago.
Colleen, the veterans agent in Georgetown is
Terry Hart,
Terry Hart. Okay.
and we have contact information for you in the office. I'm Terry
Name
Hart.
again,
Terry
you
Hart.
got it written down?
Yeah, Colleen has the contact
I
information.
can share part of it.
Is he located in Ipswich?
Yes.
Now with
Covers several towns.
with the federal VA, they do look at income and assets. Very generous though. But what happens is they can offer compensation. Anyone who has a hearing loss, any veteran, automatic compensation, meaning a check every month.
Will they make him wear his hearing aids?
They pay for hearing aids.
Will they make him wear them? No, that's the tricky
Oh,
thing.
well.
Well,
Still
But
up
they'll
to you.
pay for them. And I mean, hearing aids are what, $5,000-$6,000. VA will pay for those.
Is that income based as well?
Pardon?
Getting that benefit, is that based on income as well? In other words, can anyone use that or is it?
You have to be a veteran,
Yes, yeah.
right? And you have to be connected with the VA healthcare.
Okay.
I just had a gentleman who went through the process way over income and assets, so there was no actual monthly compensation, but he's getting his hearing aids for free. He's saving $7,000 by getting his hearing aids through the VA. So if you're a veteran, you need to explore the VA. Even though you might not need it right now, you don't know what's going to happen. But compensation, health care. Any questions? I know, everyone's going.
help.
I have an Advantage plan and I have an out-of-pocket limit of $3,400. Now, if I ended up going to the hospital more often than I expected, does what I'm paying my $500 for each day for the first 5 days, does that go toward the 34 out-of-pocket limit?
Your plan will tell you that. There is people get confused about this.
Sure.
There's a very big difference between a deductible and an out-of-pocket. So you pay your co-pays and they all add up. They keep track.
Okay.
And once they reach the $3,600, then that means you have no more co-pays
And is
for the
that
rest of the year.
$500 a day for 5 days, is that a copay or a deductible? That's a copay, I think, isn't it?
What, when it's $500?
Hospital admit, if I happen to go to the hospital several times and it's $2,500 for the first 5 days each time, does that?
That counts towards your out-of-pocket limit. And the only thing, different Medicare Advantage plans count different things. A lot of them don't count what you spend on drugs as that out-of-pocket limit.
Right.
But they will tell you that
Okay.
in your plan. Any other questions? Well,
There was, I read somewhere, and I don't know where, I'm sorry, that funeral plans were paid by Medicare for $250.
no, what that is, that's paid by Social Security,
Oh,
and that's only offered to a spouse.
Huh.
That it's called a death benefit, $255.
to a spouse, if that person's not covered, you mean?
No, it's a social.
If
I'm
your
sorry.
husband died, you can apply to get that, but they're only gonna pay a spouse. It used to be, it was a benefit but now they're only gonna pay a spouse.
That's what the word I read was benefit, so that's why I was curious.
What do you mean by a spouse? If I died, then my husband would be a spouse, right?
Right.
And or if he died, I'd be the spouse.
Right.
So either way,
Either way, it's only a spouse, right.
So you have to be married.
I'm sorry?
So one has to be
One
married.
has to be
Yeah.
married, right,
Have to have a
right.
spouse.
Right.
Correct.
So
It's
so
a
That's all
spousal,
they're
it's a
paying.
spousal benefit only for spouses.
I
So
see.
if one spouse dies and is involved in the social security system, then the live spouse can apply for that benefit and
I
get
see.
$255 towards funeral expenses.
I see.
But it needs to be spouse to spouse.
So a single person,
So how do
they're
we
not,
get a
they're not.
Yeah, they used to
Right.
pay, but they changed that. Anything else?
Can you leave, because Massachusetts has the open enrollment, can you leave an Advantage plan and go to original Medicare anytime?
You can only change your Medicare Advantage plan during open enrollment.
Okay.
And it starts for January 1st. Now, Medicare is Medicare, that's federal, but these things that we talked about, the yellow paper, the blue paper, prescription advantage, they only apply to Massachusetts. If you have a friend who lives in New Hampshire, none of this applies to them. Every state is different. Medicare is Medicare.
So on this Medicare preventive services list, this is quite a list of things that Medicare will pay for. So does that mean that you don't need as much coverage from some of these other
These are preventative services.
right.
The reason
So
that
I
you
have an
need to have a
advantage.
supplement
Yeah,
is because there are big holes in Medicare.
right.
Part A is the hospital part of Medicare, the inpatient hospital. But there is a $1,156 deductible per benefit period. And what that means is all you have is Medicare, you have nothing else. And you go in the hospital. The day one that you're in the hospital, you owe $1,156. And then Medicare is going to pay up to 60 days.
Okay.
If you're in the hospital more than 60 days, the copay is like $289 a day. And if you're more than 90 days, it's like $586 a day that you're responsible for. But the big thing is at $1,156. Day one, you owe it. Per benefit period. You go in January 2nd, you come out January 4th. All you have is Medicare. You owe $1,156. You go back in June 8th and come out June 9th, you owe another $1,156. You go back in November 12th and come out November 13th, you owe another $1,156. Once you're out of the hospital 60 days, that Part A deductible starts again.
So that's why you need these.
This is why you
supplemental
need
coverages.
something. The same with Part B. You know, you have your little red, white, and blue card. Part A, hospital, Part B, medical. With the Part B medical, there's an annual $140 deductible. So you have nothing but Medicare. You go to the doctor. Medicare is going to pay nothing until you have been responsible for $140. And then Medicare pays 80% of the allowable charge. And that's fine. You've met your deductible, you go to the doctor, the allowable charge is $100. Medicare's going to pay them $80. You're going to owe them $20. But remember, Part B covers testing, lab work. So you go in and you have a test, and it's $5,000. Medicare's only going to pay them $4,000, and you're going to owe them $1,000. So that's why you need something besides Medicare. Either a Medicare Advantage plan or a Medigap plan.
I wasn't here to start this, which is, I'm sorry, the Medigap plans are the ones that I was interested in. So I won't ask you to go over through them again, I'll bother Jerry about it.
You get our wonderful shiny
Yeah,
counselor, Jerry.
yeah. But that was
Okay.
the question.
Thank you so much, Pat. Thank you. I really appreciate you being here. This has been very, very helpful, and
I know it's a lot of
it's a
information.
lot. We'll hold on to the packets in the office too, so that if people have additional questions, they'll have that information, and we will refer right back to your office.
Yeah, everyone make sure you do your yellow form and send it in.
And we'll have some of those in the office, so that if, if people, at home would like to be able to, have that opportunity to run through the formulary and look at some of their choices for a drug plan, this is the time to do it. We'll hold on to them, and then they can get, you can pick them up from us and mail them to Elder Services, and, we'll get at least some options. All right.
Okay?
Thank you very much. Thank you.